Good afternoon and welcome. And on behalf of the Board of Commissioners and Commissioners Rich Beck, Nelson Peters, and I would like to thank you for joining us today. You know, with so many of us trying to keep up with the massive number of updates and again through a variety of media and social platforms, our collective heads are spinning on a daily basis as to what's going on and what we can do and when life will get back to normal. While none of us have a crystal ball to determine what the future holds for us, we do know that locally, Allen County, our Department of Health, our first responders, our providers and hospitals are doing a phenomenal job in all they can to guide us through this pandemic. Now today we will be focusing our attention toward our healthcare leaders to discuss the current status of operations, what they're seeing, how treatment is going at their respective facilities, how the community has come together to help, what the public can do to help the public or the health sector, and where we go from here. Now before I introduce our healthcare leaders, I would like to bring Mayor Tom Henry forward for a few comments.
Thank you, Commissioner. Good afternoon, everyone. Thank you once again for spending a few minutes with us on our weekly briefing. Commissioner Brown's absolutely right. One of the most important endeavors in this whole program of trying to meet the needs of this community is in the physical health arena. I need to continue to remind you that Fort Wayne and Allen County right now lead the state in our attempts to address the coronavirus environment in our communities. One statistic after another shows how hard that we've been working to make sure that the needs and wants and desires of our community is being met, particularly in the physical health arena. So I want to spend just a minute to thank all of you once again, particularly the media, in getting the word out to our citizens to hang in there, that we're all in this together. Don't deviate from the norm right now. We will get through this, but we've all decided, we in government have decided the best way to address this is through a systematic approach. We've had phases that have been identified, and those phases will be rolled out during the necessary time that it takes in order to go to the next particular phase. So again, I want to thank all of you. I particularly want to thank Dr. McMahan. I know she'll be addressing you in a few minutes, but she has been a true hero in this community. Besides our other frontline warriors in the health arena and public safety and elsewhere, she has stepped up time and time again. I don't know when she sleeps, quite frankly, because every time she's needed, she steps up. So, and I know she's heard this before, but as the mayor of this community, I need to take a few moments just to thank her personally. And again, thank all of you for helping Fort Wayne and Allen County be a true leader in the state of Indiana. Thank you.
Well, thank you for your kind words, and thank you. It's hard to believe it was about 6 weeks ago that we stood here. I think we're actually on the 4th floor, and we determined that our number one goal would be to keep healthcare standing, not just to provide services to folks who may be infected with COVID, but also to provide the level of care people have come to expect for other urgent conditions, including trauma, heart attacks, cancer, stroke, and the list goes on. The reason healthcare is so important that, as Benjamin Disraeli said, the health of the people is really the foundation upon which all of their happiness and all of their powers as a state depend. Sorry, I can't talk. Sadly, we often don't realize this until we don't have it. But achieving the goal of a healthcare system that is equipped to diagnose and treat patients with a variety of illnesses in large numbers is a challenge. Now, some of you may remember, some of you are too young, I think, but that we, in fact, as a community met that challenge in 2009 with H1N1. Our healthcare system was really taxed for several months, but many people don't even remember that we had a pandemic. That's because our health and public health systems work together to provide a coordinated response of diagnosis, treatment, and prevention. Went on for several months, but we did get through it. COVID-19, however, is not H1N1, and this challenge is really much greater. This is not a flu virus, as you've heard me say so often, so no treatment, no vaccine, no test when this pandemic started. And while they did develop a test fairly quickly, it was not readily available and not without a lot of problems. On top of that, this virus is extraordinarily contagious, can cause a severe illness in 20% of those infected, has a prolonged recovery on the order of weeks, and has a high mortality rate. All of these factors require healthcare teams to look at providing services differently. It is not just a matter of there are more sick people, there are more really sick people. So how do you manage all of that and still make sure that your dad that just had a heart attack still makes it to the cath lab services and recovers from an MI? For us to have, as sad as they are, as few deaths as we have had is a testament to the excellent supportive care provided by our medical teams. And believe me, treating COVID is a team sport. Our healthcare and mental health systems, through collaboration and a lot of hard work, planning, and professional commitment, have ensured that we achieved our goal of having our healthcare system remain standing here 6 weeks later, open and ready to provide treatment to those in need. As we move forward, learning to coexist with COVID and develop a new normal, it's important to remember that things are going to look different in retail, in manufacturing, and even in healthcare. And we have to accept that this is the new normal until there is a vaccine. Wearing a mask in the hospital, telemedicine, these are a few of the ways in which healthcare may look different in the future, but the expertise and skill in providing state-of-the-art medical care has not and will not change. We're very fortunate to have both inpatient and outpatient health and mental health systems that have risen and actually met the historical challenge that COVID-19 has provided.
All right, so we have 3 hospital systems, individuals here who are individually going to come up and give their take on what is happening in their arena. And so for the first hospital group that will be coming forward is Dr. Jason Rowe, who is the Chief Medical Officer of Parkview Physicians Group.
Thank you, Commissioner Brown and Mayor Henry. It's really a pleasure to be here on behalf of Parkview Health today to give you an update on how we're responding to this COVID-19 pandemic in the region. So as an Allen County resident myself, I suspect that probably the 3 most pressing questions related to healthcare among our citizens today is our healthcare infrastructure prepared to handle a surge of COVID-19? Is there a plan to get back to normal? And perhaps most of all, is it safe for me to go to the doctor, to go to the emergency room, to go to the hospital? So let me reassure you on all 3 counts. At Parkview, we have a detailed surge plan that is designed to markedly increase our intensive care unit capacity and capacity to provide mechanical ventilation, and even our total number of hospital beds if needed in response to a surge. We also have a tiered plan to gradually resume normal operations starting in the next several days and beginning there over the next few months. And both the surge plan and the return to normal operations will be fluid so that if we start to see the number of cases of COVID-19 rise in the community, the number of hospital beds occupied increase, then we can put a hold to some degree on restoration of normal operations and flex the plan to the need of the community. We also recognize that as we restore normal operations, we're actually moving toward, as Dr. McMahan indicated, a new normal. And that new normal recognizes that COVID-19 is not going away soon. And so our focus really, as we move into this new normal, is how do we provide the safest possible environment for patients, providers, and coworkers in this new era of COVID-19? So on behalf of my colleagues at Parkview, I'd like to express, first of all, our deep appreciation to the community for all the many ways that you've supported us and the entire healthcare community here through this pandemic. The prayer vigils, the first responders coming out and encircling our campuses with their lights on, the flyover from the 122nd, all of these things and so many more, in addition to the food donations by local restaurants and businesses, the overwhelming turnout that we had in the Make a Mask campaign to help provide masks for our patients and coworkers. All of these things just really have felt our healthcare workers to feel lifted up by this community during this challenging time. We also appreciate the community's adaptability and patience and grace because we know that we've had to make a lot of changes in response to the governor's executive order and just things that we need to do to keep people safe in this community. So the visitor restrictions, those have been very hard for people. The delay in surgeries and procedures and appointments. And even having to do visits virtually, as Dr. McMahan alluded to. You know, I'm a family doctor, and early in my 20-year career practicing in rural Fulton County, Ohio, which is just over the border a bit, I did house calls. And it was amazing to me. It struck me as I did my first few video visits a few weeks ago. I think video visits are the 21st century version of the house call. And it's just amazing to be able to reach out to people in their own homes where they feel comfortable and be able to provide the excellent care they need right in their own homes. So amazingly, by the time April is out, we will have done over 20,000 virtual visits just at Parkview in the month of April. So that's unbelievable to me. So these changes have all been necessary to help us protect one another, but change is hard, and we just appreciate the community being adaptable and working with us on that. And I'll be honest with you, also very proud of our providers and coworkers, because change is hard for them too, and just tremendous teamwork and flexibility has been shown by our team. So going forward, individuals in the community, as Commissioner Brown pointed out, may wonder what they can do to continue to show their support. And I think the first thing is we need your continued patience and grace, because this movement towards resuming normal operations, it's got to happen in tiers, and it's got to happen in response to our ability to respond to any surge in COVID-19 in the community and availability of personal protective equipment and other things. So bear with us. The second thing you can do to help us is to just remember not to delay emergency care that you need. So if it was an emergency before March, it's an emergency today. So if you have chest pain or shortness of breath or other things that require emergent care, please, please seek that care. I can assure you that every emergency department in this city, and I think my colleagues from the other healthcare systems here today will assure you that our emergency rooms are safe. And the third way, and maybe the best way, to continue to support all of us in healthcare is to continue, even after the executive order to stay at home expires, to continue, as Dr. McMahan has often pointed out, to practice the social distancing, 6 feet apart, to wear the masks when you are in contact with other people, and to continue to practice good hand hygiene. So all of these things really do work and really will help to prevent a surge in the community as the community reopens. So please know that at Parkview, whether we surge or whether we continue to move towards reopening, our team of experts is doing everything we can to ensure a safe place for you to receive care in this new normal. And we'll continue to partner with the city, with the health department here and in the state, and also with our partners at other healthcare institutions in the region as we work together to safely reopen healthcare. I want to reassure you, since 1878, you've been able to count on us. You can count on us today. We've got this.
Hey, thank you all. Thank you, Commissioner Brown. Thank you, Mayor Henry, for giving us the opportunity to come here and talk to the community. And like Dr. Jason, prior to me, said, I initially want to start with applauding the collaboration that has been across this community between the State Department of Health, the healthcare systems, and other people in the community that has resulted in a very, very thoughtful and thorough approach how we would take care of COVID-19. So since we started, there were a lot of things, there were a lot of recommendations that were coming out, there were a lot of guidelines, and they have constantly been fluid and changing. We have been very adaptive to everything that's been going on. We continue to monitor very carefully what the recommendations from the CMS are, the CDC are, what the recommendations from the state are as we continue to alter our approach to COVID-19. Like my colleague before me said, are we prepared to take over COVID-19? Absolutely yes. Is it safe to present to the hospitals to get further care? I would say absolutely yes. So I want to thank the community in their approach to us. I mean, since this happened, the restrictions at the hospital with no visitors and all, we set up new ways to communicate with the families. We've applied technology, and we've been overwhelmed with the response we've received from our patients and their families. I also want to thank people for their generosity, our first responders, how they've showed their support to the healthcare systems and the community as a whole. We've had donations from people with food. We have people making masks, and it just shows how this community has come together to face this pandemic. I think this is probably a first in all our lifetimes, and I hope it to be the last. But as we move forward, we have laid down a very thoughtful and thorough plan in collaboration with everyone in the community, Department of Health, the state, and other healthcare systems, how we slowly open up care to the community. Because as you know, a lot of things have been on hold. There have been medically necessary procedures that if we wait too long, that could be very detrimental for our patient needs. So as we slowly open up, we've put in a very thoughtful approach as recommended by our experts in the hospital and other in the healthcare arena, how we slowly open up. So we're basing our prioritization based on the risk to the patient, the risk of the procedure, what's the medical necessity of the procedure, does it need to be done within the next few days, within the next month, within the next 3 months. Based on that, slowly, with very purposeful and thoughtful screening, we have started opening up our healthcare system to start elective procedures. So as people start coming in, we want to assure our patients, based on CMS guidelines and other literature, we have made COVID care zones and non-COVID care zones and transition care zones within our hospitals, so we completely delineate. So when you walk in, you would know we are taking care of COVID care patients in this zone. And we have non-COVID care zones, which we call green zones, which we feel that safe to traverse. We have active monitoring and screening within our hospitals, so no staff member walks into the hospital without filling in a screening questionnaire. We're putting in temperature checks in place, so we know and we catch any symptoms early. So this is all to provide safety for our patients and for our caregivers. So the other thing I want to emphasize, and my colleague before me emphasized, is while all this, there's an apprehension, should I go to the hospital? But there are conditions we really need to be monitoring. There are conditions like stroke, heart attacks, chest pains. I would absolutely want to encourage people, do not ignore these symptoms, because these conditions can be deadly. You need to come to the hospital. You need to call your providers. We have said in everything we can to provide a safe and secure care for you in our hospital systems. Lastly, I want to say, just emphasize on what the healthcare or the community needs to continue to do. We really are watching our cases day by day in the community, in the state, and in Allen County. And we are still seeing cases fluctuate a little bit, right? So a couple of days ago, we saw 49 cases that were newly diagnosed. So really want to keep a very close eye on the prevalence and incidence in the community, because as we open up and if we see the numbers go up, we might have to retrace our steps and rethink our strategy again. We are very fluid, very prepared. We have a lot of capacity. We've prepared for resurgence of disease. So we continue to watch our supplies, our ventilators, ICU beds, and we are prepared. If that research had to happen, we can quickly move on it and retrace our steps, step back, and go back to what we were doing 2 weeks ago. But with that said, that we don't have a research. Our community needs to continue to have universal masking. We need to continue to have social distancing. We need to make sure that we are doing everything, we're doing hand hygiene, and everything that we can do to prevent a resurgence. With all said, I really would thank Dr. McMahan and everyone else in the community, our other healthcare systems, the way we have come together and collaborated through this process, and I'm convinced we will continue to do so, and we be prepared to serve our community at the best we can. So, thank you.
Thank you, Commissioner Brown. Thank you, Mayor Henry. And thank you to Dr. McMahan. I just want to reinforce and reiterate what others have said from this podium about the amazing job that she did at coordinating our response to COVID-19. It is, without a doubt in my mind, the thing that has flattened the curve for us. You've heard that term used before, but it is what my opinion is, that she, by her leadership and by the leadership of our school leaders and business leaders, have done a great thing in terms of flattening out how we in Allen County have seen this disease spread. It has behaved differently here, much less extremely here than it did, for instance, in Indianapolis. I am the Chief Medical Officer for IU Health here in Fort Wayne, Indianapolis, or Indiana University Health in Fort Wayne, part of a much bigger organization, 30+ thousand employees, 33,000 employees statewide, 16 hospitals scattered throughout the state. And we have been very integrated up here with the rest of the team for IU Health, so we have a clear understanding about how this has presented statewide. Indianapolis, as you probably know, had the most cases in the state, both in the city itself, but also in its perimeter. And the hospitals in Indianapolis reacted to that in really admirable ways. The company as a whole, IU Health, had an incident command similar to what Dr. Rowe's incident command was for Parkview Health and for Dr. Bhatia's incident command. All of these organizational maneuvers are done in order to be able to keep everyone communicated clearly with and to be able to have strategies that can be applied broadly for all of our hospitals and all of our healthcare workers, both to provide best care and also to protect our workers and manage our protective equipment. So IU Health has had a statewide approach to that, and it's been really good because it's allowed us to share resources, to move ventilators from regions where there wasn't a high need to places where need was very high. And there was never a time during the course of the biggest surge that happened here in Indianapolis when they didn't have the equipment that they needed. Personnel were moved from hospital to hospital to be able to help with those surges. And so that's sort of the idea behind this concept of coordinated care and collaborative care. So I wanted to speak first to that. The second thing I wanted to talk about is healthcare that is ongoing. Because COVID-19 has dominated our lives, all of our lives, healthcare professionals as well as everybody in our communities, and we know that. But it hasn't changed the fact that people who have chronic disease have chronic disease. We want to make sure they're being taken care of. I know early in the course of this, our patients really stayed away from healthcare for two reasons. One was that they were afraid and wanted to make sure that it was safe to approach the healthcare systems to get their healthcare. But secondly, I think they really wanted to make sure that they weren't burdening us when we were turning our attention to something that was so dominating. And what I want to make sure that we convey to the community is that healthcare needs to be managed ongoing. People that have diabetes and heart disease and lung disease, a variety of other types, those issues don't go away. And we want to make sure that all three of our systems in this town are here to make sure that those things are continuing to be taken care of. So access to us may be a little different than before. As Dr. Rowe described, telehealth has become a large part of how we deliver healthcare here. And we're doing virtual visits every day now. All three systems are accomplishing that. We do know that there are some things you have to be seen for in your doctor's office. So in our primary care offices here in town, there's about 25% of the patients that we customarily had seen that we are now beginning to see in our offices again, to make sure that anything that requires a doctor's hand-on evaluation is actually getting the attention that it needs. And we're doing that with making sure that appropriate protective equipment is in place, masks and gowns, et cetera. So just know that when you contact your doctor's office, you'll be triaged. Some of you may end up being seen directly by a doctor. Some of you may end up having a virtual visit, but you will be seen by all of the systems in town. The last thing I want to talk about is the public itself and how it has rallied to this. And I want to just share two very specific stories. I'm sure that everybody in this room has stories that are similar. But one of those stories is about Hens Manufacturing. I came to the podium without my mask on, but I assure you I had this mask on right up until I walked to this podium. This is a mask that's an N95 equivalent. You've heard this term N95. It has the ability to filter 95% of the particles that are in the air, and it is the mask that's necessary for those who are front-facing patients with COVID disease. It's necessary for our healthcare providers to have it on, especially when there's aerosolization of anything that's getting into the air of a COVID patient. Hens Manufacturing, which makes Cindy bags, has switched themselves to a place where they began developing and manufacturing N95 masks. And I want to talk about this because it was such a great collaboration between Parkview Health, who provided the FIT testers. These are occupational health testers in their organization that evaluate people's fit for masks. They came to Hens Manufacturing once they had created a couple of prototypes, and then actually began to revise the mask according to what their specifications were until it became N95 compliant. So it's an example of a local business who's risen up to accomplish something specific to the healthcare needs of our community and of the state. And the second is, I'm sorry I dropped this mask, but I just want to talk briefly about cloth masks, because we know that cloth masks have not been regarded as appropriate for in the hospital and in our healthcare providing settings, but it definitely is appropriate for you to use in public. We want you undercover. When two people are undercover, it basically makes both people safe. So use these masks. I just want to talk briefly about this because this is a quilting group that manufactured these masks. It's Appleseed Quilters, and they produced 800 of these masks at the very beginning of when all of this happened. It was a group of maybe 20 sewers that began production. And I know that this kind of thing, grassroots, has happened throughout our community. So I want to thank everyone who's taken the initiative to do these kinds of things. Thanks very much.
Thank you, Dr. Randolph. Well, I would like to thank our speakers today for all the information that they have conveyed to you and to us. And at this point, if it needs reiterating, I suspect it continually needs to be reiterated. Self-distancing, proper hand washing and hygiene, and face coverings. You will probably be hearing that forever. I mean, just get used to it, try to work through it, make it a habit. In the end, we are here to help each other, and the only way we as a community and as a country and as a world are going to get through this is by all of us by playing by the same rules and taking care of each other. So at this time, we are open to questions, and if you would like to ask any of our presenters or the mayor or myself, we are happy to take them.
Commissioner Brown, I got a question for you, actually.
Yes, sir.
The gentleman from Lutheran Hospital mentioned, and the gentleman from IU as well, universal masks. Once we start to reopen the city, restaurants are allowed to be reopened, is that a decision that maybe the county will look to make mandatory?
Well, the Board of Health is a separate entity in and of itself, and I know that there are ongoing conversations. Obviously, it's something that the governor at the state's direction at the federal level is a direction that they would like all of us to participate in. Whether there is a technical order, I think that remains to be seen, but I think everyone in this room would be, it would be remiss not to say that in one's best interest, it would be a wise thing to do. Any other questions?
I've got more
Oh,
questions. but,
absolutely, if you have, absolutely, anyone?
I would actually like all three of the gentlemen from each of the hospitals to answer the
Okay.
question individually.
Not a problem?
So this is sort of a multi-part question. Yeah.
Because-
If you guys can come up with. I'll try to explain this as simply as possible so we can get through each part.
No rushing to the podium.
That's
The
right.
microphones.
So, for the hospitals, how have the numbers that clinics and ERs changed since the beginning to now? Are they positive? Are they negative? Are they up? Are they down? Do you expect the numbers to return to pre-COVID normal once we start to open back up procedures and things like that? And the comment was made that emergency rooms in our city are safe. One of the things about safety is staffing. So how has staffing changed in our clinics and in our emergency rooms in response to this, and what's that going to look like moving forward?
Sure, so thanks for asking the question. So capacity or volume census, both in the ambulatory and in the hospital world, in my experience, and I'm assuming it's probably similar throughout the region, census has been low, and that's by design. So when the order was given to cancel elective surgeries, there were, of course, a number of reasons for that. Part of it was to minimize exposure to the virus. Part of it was to conserve personal protective equipment. And part of it was to make sure that we had capacity in our hospitals should a surge occur. So as the volume of surgeries went down and as people started to practice social distancing, as we started to engage telehealth, we saw the number of visits in our ambulatory clinics, EDs, and hospitals go down. The numbers are starting to rise. Already we're seeing more ED visits in the past several days than we have in the past 6 or 8 weeks. The hospital census is starting to rise again. We think that that is, we haven't been doing any real elective surgeries yet. We think the rise that we're seeing is partly because people have either been forced to delay care or have chosen to delay care. And with some health conditions, you can only delay so long before the need for care becomes inevitable. And so that's why I think we're seeing census rise at this point. And I can't remember the third question that you asked.
Staffing. How has staffing changed in response to this? We're seeing lower numbers, so you might not need as many staff right now during this time. So how has it changed for the hospitals?
Yeah, so staffing, we've taken a very thoughtful approach to staffing because it's been a priority for us in the Parkview family not to have to lay off any staff. And so our staff have been very generous in terms of willingness to be redeployed to other areas across the health system, maybe areas they're not accustomed to working in order to meet the need in every area and provide patient care. So that's how we've been able, I think, to adjust staffing to help meet the need.
I think pretty similar for Lutheran health systems too. Again, by design, we stopped the elective surgeries and a lot of surgeries, so the volume of patients inside the hospital decreased. I think a lot less people are presenting to the emergency room with conditions actually they should be presenting. So we really don't want patients to defer their care when they should need it. We've been, if you say, around 60 to 70% of our normal volume. And again, we see those numbers fluctuate. But the good thing is our COVID-19 volumes have decreased too. Since we had the availability of rapid testing, there were a lot of people, we were waiting 2, 3, 4 days for the test to come back. So there were a lot of people we were suspecting to have COVID, now that we have been able to rule out and move them out of our ICUs. So again, I think our volumes have been down. They have been by design, kept low. And again, as we start to open up, I think the volume will start going up. Will they go back to their usual levels. We just have to wait and see what happens with the disease and resurgence of disease. I really do think the community feels insecure in coming to the hospital system, and that's why we try to make all these safe zones and have everything ready so they can feel safe and secure. And that's not only for the patients, that's also for the caregivers, physicians, staff, and everyone else in the hospital. The other question was staffing. Again, like Parkview, we have redeployed a lot of staff in other places they can work. So we have been flexing our staffing. On the ambulatory side, we have gone to a lot of telemedicine visits, so probably I think we're doing more telemedicine visits than actual visits. I'd have to look up the numbers. But we have really expanded our telemedicine program, so that does mean flexing of staffing. So as soon as we see numbers going up and things change and things open, we'll flex accordingly. I do want to thank our staff in being so flexible. They have been have to perform different roles during this crisis, but we felt they are true heroes, and we felt that enthusiasm for them to be willing to do everything they can to serve our community. So, did I miss a question?
No, thank you.
Any other questions?
So you're not commenting?
I can comment, I just don't know if I was commenting.
Any other questions? Well, thank you, everyone, for being here today. Any other questions? Feel free to approach anyone at this time. So thank you again.